What it means is that rather than the caregiver in the back of the ambulance looking at a bunch of raw data or transmitting a bunch of raw data to the hospital where we don't have enough physicians to sit and watch all those screens, instead this device has built into it smarts to look at this data and tell it higher level things like patients low on blood, low blood volume, cardiac arrest. And what's really neat about it is it's using some really advanced algorithms and things that are just coming out from academia where we can actually predict whether the patient is going to go into distress or whether the patient's going to crash before it happens. So the caregiver in the back of that ambulance can know, I need to pay attention to this person right now. And that directly came out of our work with the military where you have one medic taking care of a bunch of guys at once. Same thing can happen in the back of an ambulance and then transmit that higher level information back to the hospital.
So what you're telling me is that in San Diego, some breakthrough things are happening that are allowing different groups of people, the police, the firefighters, even the social service workers. Mm-hmm. So I heard from Dan, in fact, earlier that through the use of these sensors, devices, these analytical tools that can predict what's going to happen, that in fact emergency room admissions have decreased by 70%.
Exactly, that's what I understand as well. And one aspect that I think is really important is what we're talking about here is just for one single patient. But now let's start to think about what happens in a community. At any one time, we could have tens of patients, hundreds of patients in transit. How do we know which is the right medical facility to send them to based on their condition, based on medical resources? And this becomes so much more important when we're dealing with a disaster scenario. One of the problems that happened at the Oklahoma City bombing is there was such a mass casualty event that patients were, to oversimplify, scooped up and taken to the nearest facility that may have been overextended in that one area of specialty that they required.
Yeah.
So by integrating this information from all of these patients together with live feeds of the medical resources that we're getting from Dan and from others, we can then match up the needs of the patients that are inbound with the abilities and resources of the medical facilities and optimize all of that.
So, guys, how do we take this further? San Diego is proving that this stuff is working. Is this correct? We are showing that it is possible to collect data and share it amongst different stakeholders. Even that is a surprise to many people. So now we've shown that. Why are we keeping it a secret in San Diego?
Well, I think you need to start small, learn from that, and then grow big, as opposed to trying to do some massive thing from the outset. You learn so much when you do things from the ground up and then build off of a success. It's a lot easier to attract people to it as well.
Okay, you're the technical guy. He's the guy whose forte is bringing government, non-government people together. So what do you do?
Well,
what are your plans, Dan?
Well, let's talk about the vision. This actually started a long time ago in San Diego. And over the last 3 or 4 years, they've gotten the San Diego region, the community, they're there. And it was funded by the federal government. It's called a beacon. And it's a beacon for a path forward. So you visualize a path forward in the light. Well, they've seen the light.
Yeah.
So now what's happening is they said we need to extend this beyond. We need to move this across the country. We've learned a lot, but others have too. So how can we better collaborate together? So fortunately, one of the things that Kevin's firm brings in is collaborate.org, which is a common platform. So those pictures that were on whiteboards, we can actually capture. And we can help them to educate and move people forward. So what's happening now with San Diego is they have set up the Beacon Education, Analytic, and Coordination Hub, otherwise known as the Beach. So they're moving their efforts forward and they're moving out to collaborate with this. So I think you're going to see more of these types of things. And each of those stakeholders, when we went around the picture and we had the fire department, the emergency room, the ambulance and those, as these people moved around the process with these, we now have their peers in other jurisdictions all around the country. We have the private sector saying, wait, that's a pretty good idea. How did you come up with that? So one of the things that's happening now is Dr. Killeen and his chair, Dr. Chan, are moving this out across the country and launching that forward to do this. Through the work that Kevin's done with collaborate.org, it won't just be domestically. We have people coming in from around the world. So it's really an international model to do this.
So we all of us know we're right now in a place where the Affordable Care Act is just rolling out in this huge controversy nationally. Meanwhile, it sounds like there's real progress being made in San Diego. How do we move forward step by step in a reasonable way to help each community almost do what San Diego did? One thing I've heard of is the Institute of Medicine has written a report about the local community as a learning system for health. So it sounds like San Diego is just a terrific example of that. So how can we take this and make this a learning system for health? Can collaborate.org be such a thing?
I think it can certainly facilitate that, but I'm going to definitely let Dan be the one to get to address
Yeah,
this.
so as we look at this, there's a lot of opportunity at the Affordable Care Act. It's changing the way people think about their health care. It's in the news every day.
Yeah.
For a number of reasons. But what the focus they did in San Diego is they said, let's start small, the ground up. It's really about the neighborhood and the people in the neighborhood working together. And it's about the individual patient. And we see, as Kevin described, the devices that can help individual patients to improve their health and move things forward. So the Beacon, there were 17 of them originally funded. They're bonding together to move this forward in order to enable people, empower people to be in charge of their own health care. But let me correct that. They're empowering people to be in charge of their own health. So when you talk about the Affordable Care Act and you talk about those, it's the business of health care. It's not about health. One way to save money is to have people who are well and aren't sick. So this is part of the process to move forward from the bottom up while the health care is coming from the top down, and the two will meet in the middle. And it's going to be a little bit interesting to see as they merge together. But I think the outcome in the end, the technology is now empowering patients to be in charge of their own health. So now let's make them healthy and well. And let's get them out of the emergency department. As Dr. Kleen says, we are the most expensive. We're good health care, but we're expensive. So let's transform that and let them work together on their own and with their family and their community.
Well, I think we've heard a voice of hope. This is a very difficult area, the transition from healthcare to healthy, thriving communities. I am encouraged and I have inspired by the story of San Diego and how they have mapped a road to health with the help of NASA and the Department of Defense and the VA working together, but also with the community health centers, the social services. What I see is a very hopeful story of how the community has come together to help the homeless vets, amongst other people in their community, to live more happy, healthy, thriving lives. So thank you, Dan, for coming.
Thank you for having us.
Thank you, Kevin, very much. This has been a great session. And thank you for bringing your toys. It's been fun. Okay, good night. That's it for us. Just picture it.